want to talk about the Patient's Bill of Rights, because I think the people of this nation would be surprised to find out that we haven't yet enacted the Patient's Bill of Rights. It was 1997 that we started talking about a Patient's Bill of Rights, about enacting so we had national protection against the arbitrary practices of private insurance companies. In 1998, President Clinton, by executive order, applied the Patient's Bill of Rights to the government insurance programs. But today, there's still no protection against private insurance companies for the Patient's Bill of Rights. So I'm very pleased that the Manager's Amendment added 4 very important provisions that I authored by an amendment that I've been working with Democrats and Republicans over the last decade to get in federal law, access to emergency care. Let me talk about that for a moment. Because today, there are people that live in New Mexico and live in Montana and live in Maryland who go to their emergency rooms and they read the fine print of their insurance plan. They say, well, before you go to an emergency room, you got to call for pre-authorization. Or you need to go to the emergency room that's in network. Or we may second guess whether you really needed to go to that emergency room if, in fact, your final diagnosis was that you didn't really have an emergency need or condition. You may have been sweating the traditional chest pains, the traditional symptoms for a heart attack. You did exactly what a prudent layperson would do, get to that emergency room as quickly as possible and find out it wasn't a heart attack. And today, the insurance companies can second-guess your coverage. Well, thanks to the Manager's Amendment that Senator Baucus helped us put together, we now are going to cover access to emergency care as a requirement for every private insurance company. Prudent layperson standards, no pre-authorizations. Get to the closest emergency room as quickly as you can. Well, that's an important protection to get in federal law. And then to be able to choose your primary care doctor. Your primary care doctor is the person you have to have confidence in. If you're a woman and you want it to be OB/GYN, you should have that right. Many insurance companies deny that to you today. If you're a parent and you want a pediatrician for your child, you should be able to have a pediatrician as your primary care for your child. Not guaranteed today. Many insurance companies deny it. This legislation will make sure that those protections are in law. So for all those reasons, I'm pleased, and I know the people of Maryland are going to be pleased to know that at long last we get the Patient's Bill of Rights protected. There are a lot of groups who have supported this over the years. I just really want to acknowledge the long list of people, long list of groups, bipartisan groups that have worked from AARP to Consumer Union to the NAACP to the SEIU, the YMCA, and the list goes on and on and on, of groups that have supported the Patient's Bill of Rights against private insurance companies, that at long last we have the ability, with the passage of this bill on the Senate floor, to move it one step closer to passage and to be the law of the land.